One story really hit me. There's this woman named Karen, and she recently went on Medicare, and she's dealing with a complicated cancer, and she's got a recurrence. And she was treated at University Health System, and now they don't accept her Medicare and not the carrier she's on. So she's being treated way too slowly, sadly. So I called Karen. We sharpened our pencils. We put our heads together and we wrote and called and advocated together. And inside of 2 weeks, we got her in to the old doctor. We brought the doctor who had treated her before into the mix. And that doctor, we explained the whole situation, and that doctor got on the horn and advocated for her too. And it seemed like it was impossible, because if people tell you this is out of network and it's a no, you never think it's going to work out. It worked out.
But how? Tell me how. How did you get someone who's being told they're out of network?
So this goes to the insurance beast, as there's even automatic denials that probably shouldn't be happening for coverage of things that already happened, like bills, for pre-approvals of things that should happen. Recently I had a woman who couldn't believe she was denied for pretty standard protocol for breast cancer. And I talked with the doctor, and the doctor said, "We've been doing this for 20 years. This is clearly reasonable and customary." So why they would send her a letter saying this isn't reasonable and customary, I feel like she lost the lottery and they just do this randomly. I can't explain it. It feels like a scattershot denial. I have seen this happen a lot of times. There's that bias that's baked into the system. So if you just communicate really clearly with the right stakeholders, you choose the right words and you say them to the right people at the right time, you can move the needle. You really can.
Quick pause. I'm Samira, a cancer survivor. This channel shares real stories in an easy to understand fashion, guidance for the hard moments during the cancer experience. If this helps you, and it helps you having us in your corner, you can subscribe for more videos like this. Now back to the show.
So Rebecca, tell us, give us an example of what are the right words for the right stakeholder? What's an example of?
So the right words to the right stakeholder would be, okay, in the case of that story I told, right? It was a matter of getting the doctor who had been treating the patient to say, this is your patient. This is a case that you started. And we believe that this is a continuity of care situation, by virtue of the fact that it's the same person and it's the same disease. So could you see your way to advocating with the health insurer using those words? And that's it. They're magic words, right? They really are magic words. In the workplace, it's a different kind of magic words, because in the workplace, I never have ever told somebody that they should actually bring a lawsuit. What a waste of time. When you're on a health journey, you really want to do that? No, you don't. But you know what you want to do? You want to make it clear that you know what the rules are by using the words that echo them. And that way, they listen to that, they see that. What do you think they do? They take it right to their lawyers, and the lawyers go, you know what? Maybe you should just give her 3 months severance instead of doing this, because they see it. Again, it's practical. It's not really legal. It's practical. Everybody's trying to avoid the same thing, which is owing a lot of money for doing something that they shouldn't have done.
What are the magic words to an employer?
It would be things like reasonable accommodation would be a big one, because that comes right out of the disability discrimination law. So you would say something like that, or you would talk about active treatment is a big phrase, because they don't want to, let's say they don't want to give a patient a longer leave of absence. Well, a person in active treatment, okay, that's a really different story, right? Like, those are the kinds of things. They often will come back and go, well, that would be a hardship. That's their word. because that's the word that they get to carve out being reasonable. They go, well, we can't be reasonable because it's a hardship, right? So you can anticipate they're going to use that word by going, well, there are people in my department who have said that they're more than willing and able to cover for me within reasonable business hours until I'm able to return, like that. And then it's a little harder for them to go, well, that's a hardship, right?
Thank you for watching the Patient from Hell podcast. I started this because I wish I had something like this when I was going through cancer treatment. On this show, you will find videos and stories from real patients, real survivors, clinicians, researchers, oncologists who share their learnings, life lessons, tips, and tricks to hopefully make the cancer experience just a little easier. To find more videos and stories, you can subscribe or share this with someone you think this will help. Thank you.